Hey guys, so today's video is a little more vlog style. I'm actually taking you with me. We're pulled right outside of Cedars-Sinai Hospital. I'm going to get a laser on my face and I'm going to take you along for the journey with me. I'm holding this phone because we're using it as my mic. Cameron's filming this. Hi Cam.
Try not to sniffle.
Try not to sniffle. Do you guys ever hear random sniffles in my videos? That's Cameron because we're trying to treat your allergies. I'm a pharmacist. Ask me these questions. Anyway, so today I'm getting the Pico laser. The Pico laser I have posted on my Instagram before if you follow me at Dr. Mona Vand. The full name is Pico Sure Laser. I have done almost every laser that exists. I love lasers. I think they're the most amazing treatment for skincare. While they're really amazing, you have to also make sure you're doing the right one for your skin because I consider them natural since you're not injecting any foreign substance into your body. But the wrong laser for the wrong skin type can cause scarring or post-inflammatory hyperpigmentation, which is basically just redness that can be sometimes permanent post a procedure. Pico Sure Laser is great for me because I have olive skin tone. So for any of my Persians, maybe Italians, Middle Eastern, anyone who has olive skin tone, this is a really great laser. It's actually really good for brown spots on dark skin, which is kind of what I have. So I'm getting this laser for hyperpigmentation. Specifically, I have these two patches right here that really bother me. I'm wearing a little makeup right now, so it's probably hard to see, but I have suffered from really sensitive skin to the sun, hyperpigmentation for years. And lately I've been doing lasers and it'll look amazing and I will not go in the sun. You know how crazy I am about sun. And it'll still come back. I'm starting to think that maybe it's related to hormones because estrogen is a really common cause of melasma. Especially if they're kind of in circles, which I have here, then a good culprit could be estrogen. I've been on birth control for years. I actually just went off of it 4 months ago because of this reason. I wanted to experiment and see maybe the estrogen in my body is what's causing this hyperpigmentation. So if you're really careful with the sun, if you're wearing sunscreen and you're still getting some hyperpigmentation or melasma, maybe think about your estrogen levels, get your estrogen levels checked and go from there. So really quick about Pico Laser, I want to give you a quick background before we go in because we're going to park in a garage and it's loud in there. Pico laser is a non-ablative laser. There's two different kinds of lasers. There's ablative and non-ablative. The non-ablative are more mild, less downtime. In fact, this one really has no downtime. I've done it 3 times. Most of the time I have no downtime. One time I had 3 days. It probably just depends on the levels we're using. Maybe Dr. Aliabadi will be able to explain it a little in there. That's the doctor that I go to. So the way it works is it basically delivers these short pulses into your skin, and by damaging the outer layer, it just causes your skin to go into repair mode and build more collagen, build more elastin. And when you're building this collagen, you're getting fresh new skin. The cool thing about this Pico laser too is that it also really helps shrink your pores. It helps tighten your skin. So you're kind of getting multi-benefit. Honestly, the last time I did this laser, my pores were invisible. You guys always ask about therapy for shrinking pore size. There is no product, I'm telling you right now, there's no product that can actually shrink your pore size. They can maybe reduce the appearance. Certain primers can kind of blur it, but the only thing to actually really reduce the size is something like a laser. Maybe peels, I'm actually not sure, I'll check that, but lasers can really help. I love the Pico Sure laser. So we're gonna go in there, we're gonna numb for a little bit, we'll talk a little more about it, and you'll see the whole procedure. So you'll notice I have to talk quietly because we're in the waiting room, but we are at my gynecologist's office, Dr. Thais Aliabadi. But the interesting thing about lasers is even though you'd think you have to go to a dermatologist for it, lasers aren't something that only dermatologists specialize in. It's actually training that any kind of doctor, whether you're a surgeon, a dermatologist, a gynecologist, you have to go through extra training to do. So any doctor is really suitable to do it. It's just on who you trust. It's not super traditional to go to your gynecologist for it, but I love her and I trust her so much, and she's done so well on my skin. And she's also Persian, so I feel like understanding the olive skin tone is really helpful. And from all the lasers I've done, I've honestly had the best results with her, so I'm excited to just keep going. And you'll see, she's so cool. So I'm taking off my makeup because the first thing we're going to do is take pictures. You always have to take progress pictures. It's the only way you can see if something's actually working. It's also really important if you're doing any kind of laser or lightning treatment and you want to know if it's effective to make sure you're in the same light, the same position, try to do it in the same room, and that way you can get the most accurate depiction.
Cut just a few photos.
Yeah.
Is
this the best wall?
Yeah, maybe you can do against your.
Sure.
Since there's a poster there.
I always am a little red when I like wipe the makeup off. So I don't know if that interferes with it.
Oh yeah, it looks fine actually. Perfect. And then just want to take one to the left. Okay, perfect. And then to the other side.
I actually wanted to see if have you ever done Pico on the chest?
Yeah, we have.
Can we? Is that like a lot longer? Can we try that today?
Yeah, we can do that. Yeah.
Because I've been noticing a lot. I tried to scratch this away because I thought it was spray tan,
No.
but it's not. But I feel like in the past I wasn't careful with my chest, and now I'm like I feel like I should start.
So just this area here.
Maybe that's why I wore something low cut too.
Oh, smart.
So if I numb, I probably should numb the whole.
Let's numb here too.
Just in case, and I'll see what she says.
It should be less painful here, I've heard, but
okay.
Yeah, we'll just numb it anyways.
Okay, cool.
And then I'll just take a picture actually.
Yeah, sure.
Okay, good. Thank you.
Thank you.
Yeah.
Sometimes I was like so focused on my face, but then I'll be driving and it's like beating down on my chest. I'm like,
well, also behind the ears is really important too. Like around, a lot of people forget about that, but it's actually like a spot for skin cancer. It's because because like when you're driving, it gets
it's true because it's
exposed.
something you just don't even think about.
Yeah.
I guarantee no one's putting sunscreen behind their ears,
Yeah.
including myself.
It's true.
I'm like, oh sorry, my purse is right now. I don't know where to put it.
So yeah, that's also something just to keep an eye on because it is common, which is unusual.
It's frustrating, not frustrating, but it's so important. But it's such a thing to do every day. Like all this like white sunscreen around your ears and your chest, and it's like reapply every 2 or 3 hours.
I know.
It's not the most practical thing.
Right.
I've been using sprays, like with mists.
Okay.
I carry them with me all day. That way I can just reapply with a spray or powder.
Oh, nice.
Yeah, I do like my first
That's
layer.
smart.
Yeah,
Yeah.
at least that way if you're like driving and you just need like a quick spritz.
Yeah, because sometimes it's like time consuming. So
Yeah.
that helps. Let me grab this. I don't know if I used this last time. It's actually a lot stronger. It's BLT. I don't know if you were doing lidocaine on you before, but this one works even better.
Oh,
so.
really? I haven't done this
Yeah.
laser in like at least 3 months, so maybe it's
maybe,
new.
yeah. Good.
I actually think I might buy. Do you guys compound hydroquinone here?
We
Or do you send it to a pharmacy?
Mm-hmm.
Okay. I think I'm going to get a new one because I realized mine was past 6 months.
Oh, okay, yeah.
It just hasn't been working on me, and I'm not sure if my skin just doesn't react to it, or maybe it's just where I compounded it. So I'm going to try a new one. See.
Did you get it from us?
No.
Oh, so maybe
I'll try.
Biomed does a really good one.
I'll try. I used to just get it from the pharmacy that I worked at, and I would just like have someone compound it there for me.
That's nice.
Or compound it myself.
Oh, yeah, because you're a friend.
Right.
Oh, amazing. What percentage did you use?
I think it was what she wanted. Like she had sent it to me, and she gave me the exact percentages she wanted me to use, so I just made it there. But it's been old, and I don't know.
Maybe expired.
Because I forgot compounded medications are only good 6 months versus regular ones that are a year. Just because the stability, we don't know how long it's stable.
Mm-hmm. I feel like a lot of people are using that now. It's like really popular.
I think it's really.
I'm so sorry.
It's okay.
Oh, no.
Here.
Here, let me. Thank you.
I think it's helpful. A lot of people are really worried about the toxic effects of it, but the studies I've read, it's not just hydroquinone that was causing it, and there's other ingredients, so you don't really know if that's actually the issue. Also, like it's such a low percentage. Is anyone here ever concerned with it?
No, but my sister did mention something like that recently.
Some people are very against it because there was like some data that showed negative effects.
Interesting. Sorry, I just want to get this.
Yeah. That part hurts actually.
This part, yeah. The skin is thinner there.
Yeah, exactly.
And then I just want to do your upper. Yep.
Okay. Sometimes when I do this laser, just like red for an hour and goes away, and then sometimes I'm like dark for 3 days.
Oh, really?
Yeah.
Maybe sometimes she does go lower. So
I think, I could.
And that's when it's more intense.
I think so.
Yeah. We'll check what setting you were at last time.
Okay.
Let's just put a little.
Yeah.
In this area too?
Anywhere I guess you see it, yeah.
There we go.
This is the first time like treating the chest. I was thinking of doing like microneedling or maybe a peel, but I just thought while I was here I should try it.
Just try it, yeah.
Yeah.
It could make a difference,
Yeah.
definitely.
Make sure this one's okay. All right. This numbs for like 20 minutes?
20 minutes.
Okay,
yeah,
cool.
we'll move you over.
All right. So I look so beautiful right now. Just numbing up my chest, my face. This is the first time I'm doing my chest, so I'll let you guys know how the results are. This procedure isn't that painful. I don't have the best pain threshold. Everything kind of hurts me, so I like to get really numb before. It is really quick. You'll see she'll come in. It's kind of loud during it, so I probably won't be able to talk. I also have to wear goggles. It's really important to protect your eyes from that light because it's really strong. She'll be wearing goggles too. So yeah, as far as pain, I'd say on a scale of 1 to 10, it's maybe like a 5 or 6. Nothing that bad. It's pretty quick. She goes over everything with one layer. She'll pay extra attention to certain spots that are really dark and will really get it. I'd say the part that's most painful is like my upper lip and like around here on your forehead where the skin is like more sensitive. We'll see how the results are depending on what level she uses. Maybe we can ask her a few questions if she has time, and we'll see how strong I'm going and how long my downtime will be.
You have one called sculpture?
Sculpture?
It's like fat.
That's for fat, right?
Yeah.
It's always funny how one laser can do, just different settings can do so many things.
Oh yeah. And like we can adjust it for different skin types and like, you know, there's
right.
different settings we can do.
I always like tell people
problems too.
because like it's not like you can just go to anyone for laser because they have to look at your skin and figure out what your skin type is, what will work the best with you. I'd actually love to do training on skin lasers. I'm gonna try to take a class. Just not to do it, just to know.
Just to know about it?
Yeah. To know more.
Because there's like lasers for texture, there's lasers for like pigmentation.
I think
for like acne scars.
But the confusing thing to people is that so many of them overlap.
That's true.
Like so many of them are like dark spots, scars, whatever, like, and you don't know like which one to do. And if 3 or 4 different doctors are telling you different things, it can be confusing.
Yeah.
Do most people with Pico have only like no downtime?
I mean, they're read for like an hour.
But that's not like for days.
No.
All right.
It's like the easiest thing ever.
Right.
So you're red for like an hour and then it goes away. You just put makeup over it and like no one can tell.
Right.
Mm-hmm. You're not wearing any makeup, right?
No, I take it off. Just on my eyes a little bit.
I love your lashes.
Thank you.
Like a loose one, sorry.
The lashes?
Yeah, this one.
Did it fall?
Yeah. Sorry.
It's okay. Actually, you'll get an eyelash fill on Wednesday. So they're like a little loose. I requested a blanket because I'm always cold. It's actually the biggest, I feel like, complaint anyone would ever have with me across the board is that I'm always cold and everyone else could be like boiling hot and I'm cold. All my levels are normal, so I'm not quite sure what it is, but
you're vegan.
It is not because I'm vegan. I was cold before I was vegan. Do you care that we're filming it?
No, not at all.
Okay.
When were you in the sun last?
I'm always protecting myself from the sun now. Okay. I mean, if I'm in it, I'm in tons of sun. Like I haven't been laying out. I've been doing anything. My only thing is I've been off birth control since January. But could it possibly take a year for estrogen to leave your body?
No.
No? Okay.
Why?
Because I wanted to wait to do this. I wanted to give it a few months.
Got it.
Because I think that could be the estrogen. This is Dr. Ali Abadi, my favorite doctor in the world. Show her. She's my one-stop shop. She's my gynecologist and face laser doctor.
Here's your ice.
Thank you. So we use the ice roller to just kind of, it basically soothes the area because this can be a little painful, like I said. More painful for me because I'm a baby. I numbed my chest. If you don't have time, it's okay. What do you think? I feel like I have a lot of damage on my chest.
Right here?
Yeah.
Okay, let's do it.
I wasn't that, like I never used to wear sunscreen on my chest because I just didn't think about it, fortunately.
You're the camera guy that makes everyone look good.
I told her that you're the master of lighting. We didn't bring lights today, but for our interview we will. He can just use what's in the room and like move you around.
Look
and then
at your lashes. I don't want to put this on your lashes.
It's okay.
Close your eyes. You told me you have a good girl. I have to go to your girl
She's
once.
so good.
That's that. You want to adjust it?
No, it's actually good. We're doing face first, right? Okay.
So when you go home, just you're not red right now. If you feel warm, you can just ice it tonight.
Okay.
And starting tomorrow, avoid the sun, sunblock.
Like always.
Until I see you next
So
time.
like always, but extra.
Like always, extra, and don't go in the sun. Just because you have sunblock doesn't mean you can go in the sun.
Can you say this to the camera? Because you guys all say that I'm so extra with the sun, but she's with me on this. Like, tell them how important this is.
So sunblock only works for about 90 minutes. You need to reapply it. And even if you go in the sun and you have sunblock, it's better to cover your face. Wear a hat when you're
driving. You even told me even when you're just walking into the grocery store.
Right. Just cover your face.
Because it just takes a second.
Absolutely.
And then how come sometimes, like, is it always only 1 day of recovery? Does it change?
So with Pico, the recovery is very quickly because it doesn't have a downtime, really. With other lasers, you can get darker, but for your type of skin, this is the only laser you can use.
For olive skin?
Right.
Okay, yeah. And that's it.
Your chest is a little red, but
it's okay.
Ice it.
Yeah.
And no sun for you until I see you next time.
I don't mind it. I hide from the sun. I'm like hiding from the sun.
You look beautiful.
Thank you.